the screening is done once in 3 years or higher. So this is an arbitrary timeline. So if you do have any high risk, like a family history of breast cancer, or you're seeing any skin changes around your breast, these breast cancer screenings can be done much earlier. So that's about breast cancer screening. Coming on to colorectal cancer screening. So colorectal cancer basically means cancer of the lower intestine or the larger intestine. And the screening is recommended for women who are above 65 years, unless there is a family history or any risk factors such as inflammatory bowel syndrome or ulcerative colitis or any other complaints that she's been having during her having earlier. So then this colorectal cancer screening can be done post 50. But at 65 plus, yearly colonoscopy is what is recommended. So that's about colorectal cancer screening. PAP and HPV. So like breast cancer, cervical cancer is one of the top 3 cancers that can happen in women. So, but it's a highly preventable one. So the screening is recommended from the age of 25 or from the age a woman is sexually active, whichever comes earlier. It involves pap smears where we do speculum examination, internal examination, and take cells from the cervical opening, and this is sent for microscopy. Along with that, we also test for HPV or human papilloma virus. So this is the leading cause of cervical cancer and a very common infection that can be acquired by sexually active individuals. So PAP along with HPV co-screening can be done from the age of 25. For women over 40, 45, it can be done when both the tests are done together, it's done once in 5 years. If you're doing only PAP, then it has to be done every 3 years. So the cervical screening is done up to the age of 65, or at least 3 pap smear HPV co-testing should come as negative. And post that, you can stop the screening. So that is about your cervical screening cancer screening. And lastly is skin cancer screening. So yearly when you go for a checkup, you can look for new moles or change in shape of new moles or characteristic of a mole that's present in the body. So this check is usually done by a doctor, and in case there is a mole which is suspicious, biopsy is taken and sent for pathology, and depending upon what comes out to be, treatment and management varies. So these are the basic cancer screening that can be done. Depending upon your family history, if you have any other high-risk factors, you can discuss these with your doctors, and specific testings can be done when it comes to cancer screening. Similarly, general screening recommended for women over 50 is to screen for blood pressure and cholesterol. So as I said, menopause does have an effect on your cholesterol levels. Above 45, we recommend that cholesterol measurements are done. If it is normal in the first 2 screenings, which can be done yearly, you can increase the duration of screening to 2 years. If there is any bit of borderline increase, decrease, more regular screenings are required. And each time you visit a doctor for a yearly check, blood pressure also should be checked. Hypertension. So the cutoff for hypertension in Indian women would be 140 to 140 by 90. So systolic more than 140 and a diastolic more than 90 mm of Hg needs to be looked into. The cause for the blood pressure increase and treatment, if required, will be initiated. Second thing we do test is thyroid profile. So menopause increases your chances of developing hypothyroidism and hyperthyroidism. So it can swing to either direction. So getting a thyroid profile once in 2 years is very, very important. What we look at here are 3 hormones. One is your T3, that is thyroxin 3, thyroxin 4, and TSH, which is thyroid stimulating hormone. So thyroid is another screening that we do. And diabetes. So India is the diabetic capital of the world. So usually in Indians, we do recommend diabetes screening happen from a younger age group. So we start it around 30, 35 years of age itself, especially in people who have high risk, where there is a family history, obesity, reduced physical activity, sudden weight gain, any skin changes like velvety skin around the neck, darkening, hyperpigmentation, we start, or PCOS in women, we start this diabetic screening at 30. If there are no risk factors, diabetes screening can be done from the age of 45. So what we do in the screening, we test for three things. One is your fasting blood sugar. Second is postprandial blood sugar or blood sugar after 2 hours, and your HbA1c, which is basically your blood sugar control over the past 3 months. So these are the general testing. Again, it can be individualized. If you have a family history of a particular disorder, or you have any other specific complaints, like if you do have a habit of intake of alcohol, then liver function testing can be done. CBC or complete blood count is usually done to see your iron, to see your hemoglobin levels, to see if there is any infections and platelet levels. You can also get an iron profile done, because in Indian women, iron as a mineral is very low. So iron profile testing, if your iron levels are low, if you're low on your energy, if you feel very lethargic, weakness is very common, you do not have any interest to get up and work, the common cause can be an iron deficiency, it can be a vitamin D or B12 deficiency. So these are other screenings that can be done. Okay, so all of these screenings basically help us to diagnose any underlying chronic complaints or cancer pathologies at a very early stage, so that we have a lot of management options. This is about your preventive health screenings. And the last part we are going to touch upon today is vaccinations. So as we age, immunity comes down. So when immunity falls, estrogen is also anti-inflammatory, and it helps you fight infections. So when these hormones, your estrogen and progesterone hormones fall, there is high chances that you are more prone for infections very easily, and the symptoms are, and severity is very high. So three common vaccines that we recommend in all women over 50. One is the flu vaccine or the influenza vaccine. So it's given against the influenza virus, which basically causes flu-like symptoms. So this is a vaccine you have to take annually, and it's usually given before the rainy season or flu season. So in India, it's anywhere given in the month of March and April. So anyone above the age of 6 months can take it, but it's a compulsion for people who are over 50, because severity of symptoms become very, very high. So high-grade fever, multiple joint aches is very, very common. So it's a single dose vaccine which has to be taken annually. The second vaccine that we are going to talk about is shingles vaccine. So all of us have gone through a bout of chickenpox in our childhood. So all of us are prone to developing shingles. So shingles is nothing but reactivation of this chickenpox virus, which is there in us due to a previous infection. So this causes a lot of painful rashes all around your body, usually seen around the back and neck and the chest. It can also cause rashes within the ear, which affects hearing. It can cause post-herpetic neuralgia. That is, the effect of the infection might have come and gone, but post this infection, there is extreme amount of pain where there is no underlying reason. There is extreme amount of pain that is present. So to effectively prevent shingles, vaccination is a must. So there are two types of vaccines. Both are given as 2 doses. Both are taken at 2 months to 6 months apart. So there are a total of 2 doses, and once given, this is effective over the lifetime. So usually it is recommended in women over 50 years of age. It can be given to women who are younger if there is a history of weakened immune system. So basically it is if you're on chronic dialysis, if you are on any chemotherapy, or diabetic, hypertensive, or on any long-term immunosuppressive therapies, this shingles vaccine can be given much earlier. So this is one vaccine that you should, along with the flu vaccine, shingles vaccine is a must give. And lastly is the pneumococcal vaccine. So pneumococcal bacteria usually causes pneumonia, which is an infection of lungs. And this is very common, common cause for respiratory failures. So what we give in a pneumococcal vaccine is a conjugate vaccine. So it's a single dose vaccine which has to be taken, and it's usually recommended for women over 65 years of age. but it can be given earlier in adults with a higher high risk factor, similar to what we talked about in shingles. So these are the minimum vaccination that is recommended for women over 50. Other vaccination can include your MMR or mumps, measles, and rubella vaccine if you have not been vaccinated when you were a child, which is very common if you're born before 1970s, because we didn't have a vaccination schedule at that time. So in such a case, MMR vaccine is recommended. Tetanus or Tdap, that is tetanus, diphtheria, and pertussis vaccine is recommended. Hepatitis B, hepatitis A vaccine if you are working with a high, if your work or life involves high risk factors like working with children, healthcare professionals who are handling blood and blood products. In such patients, hepatitis A and hepatitis B vaccines also can be given. So this is a brief overview of the vaccinations that are recommended. So with that, we come to the end of the session. It's a very, very brief session. Menopause, menopausal health, and women's health over 50 is a very vast topic, which can be discussed over multiple sessions. So I think this is just the start of the conversation. So I think we can move on to questions now.
Thank you, Dr. Liston, for that